Well, happy Monday. Great to see all of you starting off your week here with us here on Spotlight Hawaii. I'm Ryan Kalei-Suji, joined by Yenji Denise. And of course, this is a conversation where we bring in newsmakers, policymakers, and our local and state officials to sort of talk about some of the things, of course, happening in our community. COVID-19 continues to be that topic that we will continue to try to provide information on. And we are lucky enough to once again have the governor joining us today, Yenji.
That's right. He has joined us so graciously on many, many Mondays, and we're lucky to start off our week with him again. Of course, we've been paying attention to what's happening on the mainland, and so we want to start off with that. Governor David Ige joining us from the Capitol. Good morning, Governor. Let's talk about those cases which seem to be exploding on certain parts of the continent, unfortunately, particularly in areas that are gateways for Hawaii, California, Las Vegas. What are your concerns about the case count on the mainland and how that could impact Hawaii?
Yeah, thanks, Yanji, and thanks, Ryan, for having me on. We are monitoring the case counts all across the country, especially, as you said, Yanji, from our key markets, California, the West Coast in general, Seattle, state of Washington, and Oregon. And that is a concern for us for two reasons. One, it does get harder to get tested in those communities as the case counts grow. More and more of the communities being tested, which makes getting tested for travel a lot harder. But I would like to say that we haven't seen an uncontrolled spike here in the islands since we started the Safe Travels program. And, the whole pre-testing program has been effective. It's really allowed us to bring in more than 400,000 visitors since the program began in a safe way. And there have been additional COVID cases, but we've been able to identify them and isolate them. So it hasn't become a bigger problem in the community.
Let's talk a little bit about the Safe Travels program and where we're at right now. We know that there are some lawmakers in the Senate that are calling for a mandatory second testing. We are seeing that call being made by other county mayors as well. What is the status on that? I mean, is that something that you think realistically will come to fruition with that second testing being stood up in addition to what is currently also required with that 72-hour testing prior to arrival?
I think that the challenge, Ryan, is just in the logistics of what that means. We've grown to be averaging between 6,000 and 8,000 visitors a day. And if you just think about trying to get them to test a second time, Mayor Kim on Hawaii Island has committed to testing all of the arrivals at the airport. And that's been a tremendous undertaking that the county of Hawaii is really struggling to get completed. Can you imagine what would be required for us to do a second test if we did it on the day that people arrived? Logistically, we don't have the space or the capacity, or the visitors would be in long lines waiting to be tested or waiting for the test results. Second issue really is about testing capacity. And as we've said, we have right now a testing capacity in the state of Hawaii about 5,000 to 8,000 tests per day. If we had to do test every arrival, whether it be upon arrival or 3 days after, it would definitely stress the testing capacity that we have here in the islands. And I'm not willing to let tourists take away tests that we need for our residents who are symptomatic and really need to be tested. So I'm open to what I do understand that doing more tests provides a broader level of safety. But the program is working as we expected. We are getting COVID positive travelers here, and we've been able to manage that right now.
Let's talk a little bit about Derek Kawakami, Mayor Kawakami on Kauai. We're seeing some questions pop in about Kauai. We had him on last week. He, of course, has decided to opt out of the Safe Travels program. So anyone who goes to Kauai does have to quarantine mandatory 14 days with or without a test. He was expressing some frustration because he said that he wanted to do basically a 3-day arrival quarantine. And then at the end of that 3 days, Kauai would administer rapid testing to those visitors and let them, or residents, and let them out of quarantine. Why is the state not granting that request? Is it a capacity issue, or is there something more?
I mean, I think initially, Anji, when we had initiated the Safe Travels programs, we really thought that from a marketing perspective, we wanted everybody to have the same program. If you were able to get a pre-arrival test on the mainland and you were negative, we felt that it would be too complicated to express that it means something on Oahu, but something different on Kauai, and something different on Maui, and something still different on Hawaii Island. All the mayors had different ideas about what they wanted to do in terms of a second test. So I did insist that the Safe Travels program had to mean exactly the same thing in every jurisdiction. So I am working with the mayor. He has different ideas about that. And clearly, the question I think is, would you as a visitor be willing to pay for a test, come to the islands and be in quarantine? So would you pay for a test on the mainland to quarantine in Hawaii? And then pay for a second test. And if it's negative again, then you are actually able to have a vacation. If it's positive, then you've paid to get tested twice to be in quarantine in the state of Hawaii. I'm not quite certain how many people would be willing to pay for that. And I think that's the dilemma. How do we create a program? The number of visitors to Kauai is small enough that we can contemplate a second test program. They definitely have some advantages that we don't have if we are applying the same program to the entire state. So I continue to work with the mayor to try and find different ways that we can bring travelers back in a way that's safe.
Another question that we had come in from those who are watching is about trusted partners. What is being done to expand that list? As we know that because it's becoming more and more difficult for people to get testing because of the surge that's happening on the mainland, is the state doing more to sort of add to the number of trusted partners? And what is sort of the criteria that qualifies someone as a trusted partner in a state that will qualify them to then administer the test?
Yeah, certainly, Ryan. We are working to get as many trusted partners as we can. We do want the trusted partners, to really be committed to completing the test and returning the results back to the traveler before they depart. So, the basic requirements is that they have to understand that it has to be a nucleic acid amplification test. It has to be something that is observed. It can't be just a mail order where I send you a test kit, you on your own will do the sample and then send it back to me. No, we want to be able to validate who took the test and that the test was administered in an appropriate way, so we can rely on the results of the test. And then really be committed to returning the test within the time period that's necessary so that they can get it before they depart. I mean, I think that's the basic requirements. It has to be a certified laboratory. It has to be administered in a way that we have confidence that the test demonstrates that the individual is not infected with COVID-19. And we continue to work with all of our partners to expand that network. We are also working with the airlines because we do want them to ensure that everyone who is participating with the Safe Travels Hawaii program gets the test administered and completed and is negative prior to boarding. And so they are also, the airlines are also looking to establish and identify additional trusted partners, especially in the cities that are the gateway cities, right? Seattle, San Francisco, LA, Oakland. We do want them to work with us to broaden and expand the trusted testing partnership in the best way we can.
We've seen an uptick in the number of cases reported in prisons that's contributing to us having three-digit case counts basically almost every day across the state. What's being done to protect the prisoners, the people who work there, and just the surrounding staff? Because obviously, as those numbers continue to stay high, we can't get to lower tier levels, and that restricts everyone.
Yeah, the challenge, Anji, especially in the jails, is that they're overcrowded, and the situation is not conducive to maintaining the spread of the virus. If you can imagine, for the most part, the prisons are like barracks where there's 20 to 30 people living in a room, and there's no way to isolate them. So, we've instituted a program where we've tested all facilities, and we've gone through to test all those confined as well as staff. And we did discover the Waiava outbreak, and we now are testing prisoners and staff multiple times a week so that we can begin to isolate them. But, as I said, Waiava doesn't have individual cells where we can isolate people. It's many people living together. We've segregated them and put all of the ones who are positive in facilities, and we've separated those who are not infected, and we continue to test them multiple times a week. But the challenge is that every jail facility in the state is overcrowded, and it's impossible for us to really implement any kind of program that would isolate those once they become infected, to be isolated from infecting others.
Through this pandemic, of course, we've seen how this has impacted so many on the financial side, with many people out of work and unemployment numbers. And this includes those trying to pay rent. We know that the state had set up that rental relief program to sort of help with sort of rent treatment and rate abatement for these those who are looking to help pay off some of these bills. What is the status on that? Because we know that there were a number of people that were still waiting to get cleared and receive money through Catholic Charities as well as Aloha United Way. Can you provide any update as far as how many of those numbers of people have applied and who have already received some of those rental relief funds?
Yeah, thanks, Ryan. We really have, and I wanted to take my hat off to Catholic Charities and Aloha United Way for really standing up this brand new program from ground up and really accelerating review and then most importantly trying to separate the fraud from the individuals in need and get the money out. So they've accelerated. We have dispersed to more than 10,000 families who have qualified more than $42 million at this point in time, Ryan. We have another just under 2,000 that have already been approved that we're in the process of distributing funds to. And so that's another $10 million or so. Approved for dispersal to people in need is about 53 million. We have just under 2,000 more applications that they are working through so that they can respond to the requests that we have. So, they are confident, and we've pretty much asked them to accelerate as quickly as they can. They do expect to be able to get through the last 2,000 or so applications well before the end of the year, and then we'll distribute that money to those that are in need.
Is the hope that that program could continue with another round of CARES Act funding? Does that program just disappear, come the end of the year because the CARES Act funding has to be spent by the end of the year? I would think that programs like that, because there's so much administrative processing, once you've set them up, then they can run smoothly. But having to stand up and stand down, not only that program, but others is pretty problematic. What's the status of that come January and beyond?
So I wish there was better news on that front, Yunji, but the state does not have the kinds of resources that the federal government has. And, we are looking at what the state resources we can add to the program. As I had mentioned to you before, we did get some recovery on some consumer product kind of lawsuits that we've won that we've put into the rental relief program. We've been encouraging, and I've been working through the National Governors Association to make it clear to the Congress that we need immediate relief so that we can continue many of these programs. We don't have the resources here in the state of Hawaii to be able to continue that by ourselves. And so, hopefully, I'm encouraged. At least there are discussions and people are talking about finding a solution for relief. I would agree that any relief would be better. As you know, the unemployment relief ends the end of the year as well. And certainly many in our community will continue to be unemployed, and we need federal aid to help in those regards.
I want to bring in a question from the audience here. And Krisha is asking, will the 14-day quarantine be reduced to 10 days based on the CDC guidelines? We know that recommendation has come down from the CDC. How will that new 10-day quarantine period affect the state's policies?
Yeah, we're working with LibbyChar and the Department of Health, and they are reviewing it. She told me, just looking at the data, and they've been looking at the specific data in Hawaii that we have, that they would be inclined to implement the 10-day quarantine based on, for those who are asymptomatic. I think that's what the federal guidance is, and we would likely be incorporating that into our general practices.
So the last time you were on here, we were talking about the budget, and you said the reality was, a 25% decline in revenue, which would translate to cuts across the board. Have you made any more progress in terms of deciding where those cuts will come from? Can you give us any specifics at what you're looking at?
No, I mean, we are finalizing the budget. The budget is due to the legislature on December 21st, and we've kind of gone through. Clearly, we've tried to prioritize agencies and departments. So the Department of Education, for example, our public schools, the reduction in that department is lower than we will have in others. But clearly, every department will have to reduce their budget just because of we are seeing significantly less revenues than we had anticipated.
We'd asked this question of LibbyChar last week, and I wanted to pose this question to you of what Hawaii will look like in 2021 living with COVID-19 as we see the vaccine begin to roll out, as we see possible more rapid testing that becomes available for people. What do you think people, the citizens and those residents and visitors can expect next year living with COVID-19? Is it sort of a blend between places that, and people that have mask wearing? Is that something that will continue on? And what do you think the outlook and just overall projection looks like life in Hawaii in 2021 with COVID?
Yeah, certainly, Ryan, just in terms of just me, what I'll be doing in 2021, we are working to validate that the vaccine is safe and effective. And when we do get a safe and effective vaccine, we'll make it available to the general public as quickly as we can. We do have priority people, healthcare workers, and nursing home residents and staff, because we understand that they're vulnerable and we want to keep them healthy. And we'll be implementing those priorities as necessary. But I'll be wearing my mask, Ryan, whenever I'm out in the public, until we get to the point of herd immunity, as many have said, till we can get 70% of our community vaccinated. That all of these protective measures will all have to live with, at least until we can get to that point. We do anticipate that the recovery for the hospitality industry will be long and tough. People don't feel safe to travel right now because of the impacts of the pandemic. And yet, at the same time, if and when people feel comfortable traveling, many want to come to Hawaii. They understand that Hawaii has the lowest infection rate in the country. And if I was going to be traveling, that would probably be one of the places that would be the safest for us to travel to. So I think that just a couple of things, Ryan. I think we know that there will be another global pandemic. It's not whether it's likely it will happen. And we did learn a lot from the previous ones, SARS, H1N1, those kinds of things. We've gotten a little better about how life needs to incorporate infectious diseases because it can happen. So I'm hoping that we take the lessons learned, that we have to continue to protect ourselves until there's herd immunity. And we know that we need to bring back the visitor industry, and we're working very hard to market and tell people about our success here in the islands, because everyone has taken personal responsibility. And we still know that the experience of visiting the islands, being able to learn about native culture, being able to enjoy the environmental beauty is all something that people still want to and are willing to spend money and resources to come to Hawaii to enjoy.
You spoke about the vaccine there. There was a comment here saying that the person who wrote it says they'd like the governor to get a vaccine before they do. I wonder how, if we need to get to 70%, which is what Dr. Char had said on this program last week and what you noted as well, how do we inspire confidence in the vaccine? Are you going to get one publicly so that people can see that? If we need to get to 70%, there will be those who say, I'm just not ready given how fast-tracked this has been.
I certainly am willing, Yanji. I've looked at the processes that have been going through as part of the FDA certification. The protocol is exactly the same. No shortcuts were taken. I think the primary difference in what happened is, the federal government did support, did fund, gave money to these companies to encourage them to spend the money to develop the vaccine. And that's one thing that is very different. In the past, these companies would have had to come up with the resources to conduct the research and the tests necessary to identify these candidates. The federal government supported these 6 businesses in spending the money required to validate, to identify a candidate vaccine, and then refine it to make sure it was safe and effective. And that's the primary difference. There really hasn't been any shortcut in the scientific process or the safety studies that are required to approve a vaccine.
One of the other concerns and questions that have been coming up, of course, was the Thanksgiving holiday and the gatherings and the number of people that were gathering. When do you expect that we could see any sort of impact of Thanksgiving and those gatherings in our case numbers? Are we at a point now where we might be seeing increased numbers this week if there was sort of outbreaks happening at these gatherings? Because there is sort of a delay in the testing and when people begin seeing the effects of this. But when are you folks expecting to see if there was any significant uptick because of Thanksgiving and the gatherings that were happening there?
Yeah, Ryan, I've been talking with the epidemiologists in the Department of Health, and they say, the incubation period is between 2 and 14 days. So if someone had gone to a Thanksgiving gathering on Thursday and interacted with someone who was infected, we would already have seen some indication of those infections. And when you look at the case numbers that we're seeing, we don't see any significant increase in the number of cases. So I would say this, Ryan, at this point, so far it doesn't seem like that there's a noticeable increase in the number of cases from Thanksgiving. As you know, it's really 2 to 14 days. So, we'll see through the rest of this week whether there'll be an increase. But let's just say so far so good. I think everyone took the advice well and didn't gather in the way that they normally would have, which definitely would have led to a significant increase by now.
As we're wrapping up, we know you have another meeting at the top of the hour, but we are 9 months into this. And can you tell us a little bit about, what this has been like for you personally? We talk to you on a regular basis, but how have you been able to keep up with everything during this difficult time and kind of, rally everyone as you try to keep everyone in mass and keep everyone going? Because it does seem like it's going to be quite a bit of time before we're really out of this.
Yeah, thanks for that question, Yanji. I think the most difficult part is that we do know that there are many in our community are hurting. You know, I do talk with people who are unemployed, who want to get back to work and just have not been able to. You know, I've had the opportunity to meet and talk with small businesses, restaurants who are just really suffering and, you know, have had to, you know, pivot and come up with different ways to survive. And I truly appreciate what everyone is going through. It's been hard for many in our community. I'm just really proud to be governor of Hawaii because I think virtually everyone gets it. You know, we know that we live on an island, and what you do, Yanji, impacts me. And if you are not responsible, and you know you get other people infected, they get others infected, and you know, quite frankly, Hawaii has the lowest infection rate in the country because all of us have embraced the sacrifices necessary to manage the virus. And we've done it better than any other community on the planet, I would say. So that's what keeps me going, Yanji, is the knowing that many in our community are willing to make the sacrifices that they know is necessary in order to keep others safe. I don't have to convince them. You know, I know that if I expose myself to people who may be infected without a mask, I could get infected, and that would really impact a lot of people. And many others do the same. So, you know, that's what keeps me going. It's really knowing that overwhelming majority of people get it. You know, they know that what they do impacts others, and they're willing to make the sacrifice. So, you know, I want to thank everybody for being able to do that. I do believe that a safe vaccine will be available, and we're going to work really hard to make it available to everybody who wants to get vaccinated. Certainly, I would be willing to volunteer, you know, to know that it's safe and effective. I don't want to jump the line. You know, I know that we want to make it available to those most in need, most at risk. And I'll do that, but I'd be happy to take it if it would give people the confidence that it's safe and effective.
All right, Governor Ige, well, thank you so much for starting the week off with us once again, and we look forward to hearing more from you next week as well. Thank you.
Yeah, thanks, Yanji. Thanks, Ryan. I really appreciate this opportunity. Aloha.
Right.
Aloha, thank you. Well, a mix there, Ryan. You know, we hear the governor there saying publicly that he is willing to take the vaccine, which a lot of you were asking about. So we do expect that there will be local leaders. Dr. Josh Green has said, of course, he's an emergency room physician, that he would be willing to get the vaccine, and he might be higher priority than the governor because, of course, he is in emergency medicine. But I think that, you know, as we roll out the vaccine, there will be a lot of people, and even, you know, former presidents, Barack Obama, Bill Clinton, and George W. Bush have all said that they will get vaccines publicly to really inspire confidence, because we do need to get to that 70%. But then also talking about the economic realities of all of this, the state doesn't have the funds to extend rental relief into 2021. So it's going to be up to the CARES Act. And it sounds like that's the case for unemployment as well, that we're really waiting for the federal government to act before the state can do anything.
Yeah, and I think a lot will also be determined when the legislature heads back into session again in January. They're going to have to make some of these tough decisions that the governor said that he's looking at through the budget, which will have to be proposed and drop next week or so. So he's going to have to sort of figure these sorts of things out, work with the legislature to figure out the shortfall that no doubt will be happening because of this pandemic and the impact that it's had. We also heard from him about his thoughts about the second testing coming into Hawaii. Logistically, he's saying it's just not really feasible for Hawaii to have that mandatory second testing, and they're looking for ways to expand on what currently is in place with, of course, the neighbor islands like Hawaii requesting other specific sort of rules and regulations that they can implement on their own county level. But the governor's saying he wanted it to be more of a unified approach, similar to what we've heard members of the House like Speaker Scott Saiki say. But some of these island communities are saying that they want to do things a little differently. We'll see if the governor can come to some resolutions with those mayors in those counties based on what they would like to implement.
Yeah, and speaking of the mayors, we're going to be hearing from Mayor Kirk Caldwell this Wednesday. We'll be hearing from Carl Bonham from Uhiro on Friday. So a lot to talk about in the days ahead.
That's right. We look forward to hearing from you. Once again, we thank you for your comments, and we'll see you right back here on Wednesday. Have a safe rest of the week. Aloha.